Have you ever walked out of your yearly checkup thinking everything was fine, only to feel lightheaded, foggy, or just not quite right a few days later? If you're over 60, this is something worth paying attention to. Because while routine tests are meant to protect your health, some of them, when done too frequently or without proper context, can quietly create risks of their own. Elevated blood pressure, disrupted circulation, even blood vessel strain. These aren't dramatic reactions, but slow-building responses that can lead to a sudden stroke. And most seniors are never told this, not because doctors don't care, but because the system isn't built to explain every detail. That's why this video matters. It's not here to alarm you, but to give you the tools to ask the right questions. In just a few moments, we'll walk through 5 common tests that could raise your stroke risk and how to stay safe every time you visit the doctor. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. CT scan with contrast dye. If you've ever undergone a CT scan with contrast, you probably remember that warm, spreading sensation moving through your chest and limbs. It feels strange but harmless. Just a sign the contrast dye is circulating, so the scan can capture clearer images of your organs and blood vessels. For many, this seems routine, a part of modern healthcare. But for older adults, especially those with high blood pressure, kidney challenges, or existing heart conditions, the effect of this injection can extend far beyond the scanning room. What most seniors are never told is that contrast dye doesn't simply light up your insides for better pictures. It also interacts with your nervous and cardiovascular systems, sometimes in ways that quietly create risk. For some individuals, it can cause a vasovagal reaction, a sudden and sharp drop in both heart rate and blood pressure. The result may be lightheadedness, nausea, or even temporary fainting. For others, particularly those with a history of vascular stiffness or inflammation, the contrast can trigger an opposite response. A spike in blood pressure or sudden tightening of fragile arteries. Medical research has drawn attention to this issue. A study in the Journal of Vascular and Interventional Radiology found that older adults undergoing contrast-enhanced CT scans faced a significantly higher risk of vascular complications within 72 hours of the procedure. These complications appeared most often in patients with a history of hypertension, kidney dysfunction, or pre-existing heart issues. The interaction between the dye and these underlying conditions can quietly raise stroke risk even when no immediate symptoms appear. I remember one patient very clearly. His name was Harold Jameson, an 81-year-old retired utility worker from Michigan. He had been feeling some mild stomach discomfort and visited his doctor, who scheduled a contrast CT scan to investigate. The scan itself was uneventful, and Harold returned home, feeling normal. But 2 mornings later, something changed. He woke up groggy, his speech was slurred, and he struggled to keep his balance. At the hospital, doctors diagnosed him with a minor ischemic stroke. His blood pressure had surged during the early hours of the morning, and imaging revealed a clot had disrupted blood flow in a section of his brain. After ruling out other possible causes, his care team concluded that the contrast injection from his recent scan likely contributed to the episode by triggering vascular stress in his already sensitive system. This is not to say CT scans with contrast are bad. Far from it, they can save lives by detecting tumors, aneurysms, and internal bleeding. But they must be used carefully and intentionally, especially in older patients. These scans should not be included as part of routine checkups unless there's a clear clinical reason and a detailed review of medical history beforehand. If you're preparing for a scan, there are steps you can take to protect yourself. First, speak openly with your doctor about your entire health picture, your blood pressure history, kidney function, heart medications, past reactions to contrast dye, and any concerns you've had with previous procedures. Then ask whether a non-contrast CT or ultrasound could provide the answers without added stress on your body. In cases where contrast is necessary, your doctor may suggest hydration strategy, pre-medications, or close monitoring afterward to ensure your system responds safely. This is about informed decisions, not fear. When you understand how your body works after 60 and how it handles even routine medical procedures, you gain more control over your well-being. Because protecting your brain, your blood vessels, and your independence isn't just about what you treat, it's also about how you test. In the next segment, we'll look at a common type of heart screening that many seniors agree to automatically, even when they feel perfectly fine. But under certain conditions, it could do more harm than good. Let's explore that together. 2. Stress test, exercise test. Let's take a closer look at the stress test, also known as the treadmill test. At first glance, it seems like a wise precaution. You wear a monitor, walk on a treadmill, and your doctor watches how your heart responds under physical pressure. But once you're over 60, especially if you're managing high blood pressure or existing heart conditions, what's meant to be a helpful evaluation can turn into something unexpectedly risky. The test itself involves gradually increasing your heart rate by walking, sometimes even jogging on a treadmill. It might sound simple, but behind the scenes, your cardiovascular system is being pushed, your blood pressure climbs, your arteries tighten, and your heart is asked to perform under stress. For a younger, healthy adult, this is manageable. But for older adults, that sudden strain can expose fragile points, areas of the body that no longer adapt as smoothly as they once did. The risks are very real. Some patients experience rapid blood pressure spikes. Others may suffer from arrhythmias, irregular heart rhythms that put a strain on the brain and heart. And in rare but well-documented cases, this kind of stress test has triggered small tears in weakened blood vessels, especially those in the brain, where recovery is far more delicate. In fact, a 2020 study published in the American Journal of Cardiology tracked over 300 people above the age of 65 who underwent treadmill-based stress tests. The findings were eye-opening. Nearly 7% experienced negative events during or shortly after the test, including blood pressure surge, irregular heartbeats, and other cardiovascular responses that required medical attention. Those already dealing with vascular disease were the most likely to be affected. And these aren't just numbers. They represent real people like Dorothy Klein, a 75-year-old former school administrator from Wisconsin. Dorothy had managed her high blood pressure well for years. At her checkup, her doctor suggested a stress test, not because she had new symptoms, but just to check in halfway through the treadmill portion. Dorothy began to feel short of breath and slightly disoriented. The test was stopped immediately. But the next morning, she couldn't lift her right arm and had trouble speaking. The hospital confirmed she had suffered a mild ischemic stroke. Her doctors later concluded that the abrupt spike in her blood pressure during the test likely contributed to the event. While the test wasn't the sole cause, it brought hidden vulnerabilities to the surface. And that's what ultimately tipped her system over the edge. This doesn't mean stress tests are inherently dangerous or should never be used. In the right situations, they can be essential, but like any test, they must be carefully considered, especially for seniors. Not every person over 60 should be walking into a treadmill exam without a clear reason and a full understanding of their current health. That's why it's so important to have an open and honest conversation with your physician. If a stress test is recommended, ask whether a less physically demanding alternative could provide the same insights. Tests like nuclear stress testing, which simulates exertion through medication, or a resting echocardiogram, may be safer routes, especially if you're not showing symptoms like chest pain, breathlessness, or fatigue. And if your last checkup showed stable results, it might be worth asking if the test can wait. Coming up, we'll take a closer look at another common medical procedure, one that's often given to seniors even when no symptoms are present. And while it may appear completely routine, it could carry more risk than most people realize. Let's explore that next. 3. Unnecessary endoscopy with sedation. Let's take a closer look at something that has quietly become a standard part of medical care for older adults. The endoscopy, whether it's to examine your stomach, your esophagus, or your colon. Many doctors recommend these procedures routinely, especially after the age of 60. Sometimes that recommendation is absolutely appropriate, but in many cases, especially when there are no symptoms, it may be time to pause and ask whether it's truly necessary right now. Here's why. Endoscopies, especially colonoscopies, often require sedation, and for seniors, that sedation isn't always as simple or as safe as it might seem. Once your body is sedated, your blood pressure naturally drops, your heart rate slows, blood flow changes, and if you're taking medications that affect your circulation like aspirin, Plavix, or warfarin, it becomes much easier for things to go wrong inside the brain without anyone noticing. One major concern is that reduced blood pressure during sedation can lead to insufficient blood flow to certain parts of the brain. For seniors whose arteries are already narrower or more fragile, that drop in circulation can become the tipping point. It's not about blaming the procedure, it's about understanding how all these factors interact. Because the truth is, even low-risk procedures become more complex as we age. In 2021, researchers published a large review in the journal Gastrointestinal Endoscopy examining the outcomes of sedated endoscopy procedures in adults over 65. They found a noticeable uptick in mini-strokes, also called transient ischemic attacks, or TIAs, within 72 hours of the procedure. These weren't full-blown strokes, but they were clear signs that something had temporarily disrupted blood flow to the brain. And any disruption, no matter how brief, deserves serious attention. There was one case I'll never forget. A 76-year-old woman, let's call her Elaine, was healthy, active, and symptom-free. Her doctor suggested a routine colonoscopy just to keep things up to date. She followed instructions, paused her blood thinner for a few days, and underwent the procedure with light sedation. Everything seemed fine at first, but 2 days later, Elaine's daughter noticed her mother slurring words and struggling to button her shirt. A trip to the ER confirmed a small stroke had occurred. The doctors couldn't find another cause beyond the timing. Elaine's blood pressure had dropped during the procedure, and paired with her recent use of aspirin, it may have created the exact environment for a small clot to form and travel. Elaine recovered, but it left her shaken. She said, "I thought I was just being responsible. I didn't know something so routine could throw my whole system off. This doesn't mean every endoscopy is dangerous. Far from it. These procedures can detect cancers, ulcers, and internal bleeding things that, when caught early, can save lives. But the message here is one of caution. If you're not showing symptoms and your doctor can't explain a clear, immediate reason for the test, it may be worth reevaluating the timing before saying yes to an endoscopy, especially one involving sedation. Make sure your doctor knows exactly what medications you take. Ask them to walk you through the potential risks given your age, health conditions, and prescription history. And if sedation makes you uncomfortable, explore your options. In some cases, the procedure can be done with lighter sedation or even without it. You deserve to feel informed, not pressured. Coming up next, we'll look at a diagnostic scan that's often used to play it safe, but may actually carry significant risks if you're over 60, especially if it's repeated more often than necessary. Let's continue. 4. MRI with gadolinium contrast. Let's talk about a test that rarely gets questioned, even though it should be, especially after 60. It's the MRI. These scans are powerful. They've helped countless doctors detect early signs of cancer, spinal problems, and hidden blood vessel issues. When used wisely, MRIs can truly save lives, but there's a version of the MRI that requires an extra step, an injection of contrast dye, and for many older adults, that's where the quiet danger begins. Most people don't think twice when they hear a scan will be done with contrast. It sounds routine, but the contrast dye often used in MRIs contains a substance called gadolinium, a heavy metal designed to light up internal tissues so doctors can see what's going on more clearly. Under normal circumstances, gadolinium moves through your body quickly and gets filtered out by your kidneys. But here's where things start to get complicated. As we age, kidney function begins to slow even in people who feel completely healthy. If you already have reduced kidney performance, even if it hasn't been diagnosed, your body might not be able to eliminate the gadolinium as efficiently, and when that metal lingers, it can quietly accumulate in your tissues, including the brain. That retention may not cause symptoms right away, but over time, it can lead to serious complications. One of the most alarming is a condition called nephrogenic systemic fibrosis, or NSF. This disorder hardens the skin and connective tissues, making it difficult to move, breathe, or even function comfortably day to day. But that's not the only concern. Studies have found gadolinium residue in the brain, particularly in areas responsible for memory and balance. In some older patients, this has been linked to persistent dizziness, confusion, or a sense of mental fog in the days following the scan. In 2019, a study published in the journal Radiology followed over 2,000 adults above age 65 who underwent MRIs with gadolinium contrast. Within just 1 week, about 5% reported symptoms that resembled a mild neurological event, blurred vision, unsteadiness, and short-term memory lapses. Most of these patients also had some form of kidney dysfunction, diagnosed or not. That's a reminder that sometimes the risk isn't visible until after it's already happened. There's one story that stands out. Harold, a 79-year-old retired firefighter from Arizona, went in for a contrast MRI after weeks of nagging back pain. His doctor ordered the test to rule out spinal issues, but what no one realized was that Harold had stage 3 kidney disease. The gadolinium contrast from the scan wasn't properly cleared from his system. 2 days after the MRI, he began experiencing dizziness and a heavy mental cloud. His speech slowed. His energy dropped. After lab tests were run, the truth came out. His kidneys couldn't handle the load. Harold had no idea he was already at risk. He said, "If someone had just asked me about my kidneys first, I would have made a different choice." So, what should you take from this MRI technology isn't the problem. It's the added contrast and how your aging body responds to it that requires more attention. If your doctor suggests an MRI with contrast, always ask if it's possible to do the scan without it. Often, a non-contrast MRI will still give the necessary answers, and before any contrast is administered, request a simple blood test to measure your kidney function. It's called a GFR test and takes just minutes. Also, let your care team know if you've ever reacted oddly to imaging procedures in the past. Unusual fatigue, headaches, or skin changes might be your body's way of saying it needs a gentler approach at this stage of life. Safety doesn't mean saying no to diagnostics, it means saying yes. But wisely, with your full health picture in mind. Coming up next, we'll examine a screening that appears harmless, even responsible, but often leads seniors down a path of unnecessary treatments and surgeries. Let's explore what's happening and how to avoid it. 5. Carotid ultrasound without symptoms. Let's now turn to a scan that's often suggested during routine checkups. The carotid artery ultrasound. It's quick, painless, doesn't involve any loud machines, needles, or dyes. On the surface, it seems like the ideal preventative test, but for older adults, especially those without symptoms, this seemingly harmless scan can sometimes open the door to a path of unnecessary worry, referrals, and even risky surgery. Here's the background. Your carotid arteries are the main highways that carry blood to your brain. Over time, just like other vessels in your body, they may collect a bit of plaque, small buildups of cholesterol or calcium. That's a normal part of aging. In most cases, it's not dangerous. Many people live long, healthy lives with some degree of narrowing, and the body adjusts. But here's where the problem starts. Let's say you go in for a routine physical, you feel fine. Your doctor orders a carotid ultrasound just to check. The results come back showing 50 or 60% narrowing. That number sounds concerning. So naturally, your doctor refers you to a vascular specialist. Before you know it, you're being advised to consider surgery, maybe a carotid endarterectomy or a stent. And all of this despite having no symptoms, no fainting, no blurred vision, no weakness, no signs of a stroke. This situation plays out more often than people realize. Yet, in many of these cases, the surgery provides very little benefit, and worse, it introduces real risks. A major study published in the New England Journal of Medicine followed more than 3,000 older adults with moderate carotid narrowing but no symptoms. What they found was striking. For most of these patients, medications and lifestyle changes were just as effective at preventing stroke as surgery. And some who underwent surgery actually had strokes as a direct complication, either during the procedure or shortly after. One story I'll never forget comes from Darlene, an 82-year-old retired teacher from Western New York. She was active, ate well, and had no complaints. During a checkup, her doctor recommended a carotid scan as part of her general evaluation. It showed 65% narrowing on one side. She was referred to a surgeon and, trusting the process, agreed to have the procedure. During the operation, her blood pressure dropped unexpectedly. Though the surgical team acted quickly, Darlene suffered a small stroke. She made it through, but now lives with partial weakness in her right hand and has trouble writing, something she once loved to do. If someone had told me that I could have just watched and waited, she said, I would have made a different choice. So what's the lesson here? It's not that carotid ultrasounds are bad. They can be life-saving for people who've had stroke symptoms or who are in a high-risk category. But they shouldn't be used blindly in people who feel well. If your doctor suggests the test, take a moment to ask why. What are we hoping to find? And more importantly, what would we actually do with the information? If you're already managing your blood pressure, keeping cholesterol in check, and living a healthy lifestyle, the ultrasound may not change your treatment plan. And if a scan has already shown some narrowing, don't rush to schedule surgery. Ask if the situation can be monitored with regular follow-ups instead. In many cases, watching and waiting is the safest course. Before agreeing to any vascular procedure, it's also wise to seek a second opinion. Another doctor may help you understand the full picture and whether the potential benefits truly outweigh the risks. Because at this stage in life, it's not about doing more. It's about doing what matters most for your long-term health and independence. Let's close with a heartfelt reminder. Your health, your choices, and your voice matter now more than ever. After 60, our bodies change in ways that deserve careful attention. Not every medical test is harmful, but not every test is helpful either. The truth is, something as routine as a scan, with contrast, a sedated procedure or a simple screening can quietly shift your blood pressure, affect circulation, or stress an already sensitive system. These aren't reasons to be afraid. They're reasons to slow down, speak up, and make sure every test is truly needed for you, not just done out of routine or policy. Take a moment before saying yes. Ask for clarity. Explore safer options when they're available. You deserve to be part of the decision, not just the patient, but the partner in your care, because thoughtful choices lead to better outcomes, and feeling informed brings peace of mind. Here at Health 365, we believe that knowledge is the real foundation of well-being. That by understanding the risks and asking the right questions, we can avoid unnecessary harm and protect the strength we've worked so hard to build. If you or someone you love has ever felt strange after a test or faced a health scare that seemed to come out of nowhere, leave a 1 in the comments. If not, feel free to share a 0. Either way, your voice adds to this growing circle of wisdom. And if this message gave you a sense of clarity, reassurance, or even a little motivation, consider subscribing to Health 365. We're here for you every step of the way, asking what others overlook and always putting your health first.